Good morning, bonjour, good afternoon, et bonjour. I am joined here today with my Associate Deputy Minister Valerie Gideon and Chief Medical Officer of Indigenous Services Canada, Tom Wong, who will offer some words after I do. I first want to acknowledge our presence here today on the traditional territory of the Algonquin people. J'aimerais tout d'abord
First of all, I would like to offer my condolences to the friends and relatives of Raphaël Napa-André, who passed away on Saturday night while trying to protect himself from the cold and respect the rules in place in Quebec. Due to a major outbreak of COVID-19 in amongst Montreal's homeless population, the situation has become particularly alarming. Several organizations and shelters are finding themselves obliged to reduce their capacity and close their doors at night without being able to offer alternative assistance to people in need. Unable to spend the night outdoors and having no home, Raphaël André chose to take refuge in a chemical toilet a few steps away from the organization he regularly attended. A tragedy like this one could have been avoided. We must ensure that such a situation will not happen again. We must all work together to put that will not only protect us from COVID-19, but at the same time ensure the safety and health of our most vulnerable populations. All levels of government have a responsibility to protect individuals, families, and communities throughout Canada, and I want to reiterate that our government, the Government of Canada, will always be ready to support those who need it. A bit of hope. The Montreal Public Health Authority stated that homeless people will be receiving vaccines in order to protect them and to reduce any further risk. About 925 doses have been set aside for this priority demographic. This vaccine campaign is going well. Organizations in Montreal are working tooth and nail to inoculate these people that only seek to preserve their health. We need to continue on this path. I would like to commend the work of all the stakeholders, street workers, healthcare workers and volunteers who are working tirelessly to support our most vulnerable during this crisis. Thank you for everything you do.
As of today, in First Nations communities on reserve, we're aware of 5,571 active cases, which brings us to a total of 13,873 confirmed COVID-19 cases, and tragically 120 deaths. These numbers continue to be alarming, and now is not the time to ease up on public health restrictions. And of course, I cite these statistics to give you an overview of the situation. We must remember that these numbers represent real people, communities, and families. Throughout these challenging times, we've worked with First Nations, Inuit, and Métis partners to protect, inform, and support communities across this country. We know that with the incredible leadership that First Nations, Inuit, and Métis have shown together, we'll weather the storm of this enormous challenge. The Government of Canada, along with the provinces and territories, have engaged with Indigenous leadership across the country. Based on their input, adult Indigenous peoples will have been prioritized among the first groups to receive the vaccine. Vaccines, plural. And now it's with relief that we see the distribution of vaccines has started. Our department meets regularly with Indigenous partners along with the Public Health Agency of Canada and provincial and territorial bodies. These meetings help us in planning for distributing vaccines to Indigenous peoples no matter where they live. We're starting to see some success stories with the rollout of vaccines. For example, in the three territories that started immunization clinics aiming to reach 3/4 of the adult population with the 2 doses of the Moderna vaccine by the end of March. And the rollout of these vaccines to First Nations, Inuit, and Métis communities has started across the country and has reached approximately 169 communities across Canada. This is a good story, and we not have to keep it going. Indigenous Services Canada has been working closely with First Nations partners, Alberta Health and Alberta Health Services, to support the development of a clear, transparent process regarding vaccine planning and rollout throughout the province, for example. Over the past 2 weeks, residents and staff of the 6 First Nations long-term care homes for elders across Blood Tribe, Siksika, Fort McKay First Nations, Fort Chipewyan, Big Stone Cree Nation, and Alexander First Nation were offered the COVID-19 vaccine in priority. And last week, the 4 nations of Maskwacis have received a shipment of 500 doses of the Moderna vaccine from Alberta Health. Vaccine uptake in Manitoba First Nations has been strong, with many communities having used all their first round of doses for people identified as priorities for vaccination and are getting ready for the second dose. And in British Columbia, efforts are already well underway. For example, 600 Cowichan members have received vaccines. 6 of the 14 Nuu-Chah-Nulth First Nations on Vancouver Island were priority recipients of doses of Moderna vaccine. And we expect that these vaccines will reach 60 First Nations in the province by the end of the week. Again, good news. I want to emphasize that the vaccines that Canada is using are safe. They are approved by Health Canada after rigorous testing and verification, and they've been proven to be safe and effective. Even though the COVID vaccines are being introduced, it is important to continue and follow public health measures. Everyone still needs to wear a mask in public, stay away from large gatherings, practice physical distancing by staying 2 meters apart in public, wash your hands with soap or hand sanitizer regularly. Je sais finalement que cette période.
Finally, I know this is an extraordinarily difficult time. Since the beginning of the pandemic, we have managed to get through it by being there for each other. So please continue to take care of yourselves and your families. Follow the health guidelines to stay safe.
Check in on people that you love to make sure that they're okay, not only physically, but in spirit. We've gotten this far by sticking together, and that's how we'll get to the end. Miigwech, Nakumik, merci, thank you, merci cho.
I want to acknowledge that I'm on the unceded territory of the Algonquin people. I'm concerned about the alarming rate at which COVID-19 is spreading in Indigenous and other communities across Canada. We continue to see that First Nations being disproportionately affected by COVID-19. For example, in Manitoba, while First Nations constitute 11% of the provincial population, the First Nations COVID Pandemic Response Coordination Team has been reporting that First Nations account for a third to a half of current COVID-19 hospitalizations and over 50% of ICU admissions in Manitoba. We must not forget the underserved First Nations, Inuit, and Métis in urban settings, such as the homeless shelters. We must redouble our efforts to protect Indigenous communities, particularly elders. I urge all community members to support their leadership and follow the community, local, provincial, and territorial public health measures. Everyone must continue the efforts to keep themselves and their families safe while protecting elders and communities. First Nations, Inuit, and Métis have worked diligently to control the spread of the virus in their communities up to now, and we acknowledge their strength and resilience and the hard work they continue to put into leading their communities to safety. Vaccines provide another layer of the other public health measures for elders, for our family, and for our community. I would like to reiterate that vaccination is a personal choice. Some elders who have chosen the vaccine have been sharing their experience on social media. For example, Ukacho First Nations elder Mary William broke into a grin after being the first person in the isolated Moderna vaccine. And she said, "Every day when I go out, I'm wondering, am I bringing the virus home to my family? But now I know it's not going to happen." C'est un exemple de succès.
This is an example of the successes of co-planning between provincial and Indigenous partners. Demonstrates great leadership by elders within their communities.
Les vaccins contre
COVID-19 vaccines will protect all this population, especially our elders, and those that are of higher risk.
Federal, provincial, territorial, First Nations, Inuit, and Métis partners is mobilizing vaccines across the country to keep everyone safe. Merci, Makumik, and Miigwech.
Merci, thank you. Nous commencerons avec par les
We will begin with questions on the phone.
questions on the phone with one question, one follow-up. Opérateur?
Thank you. Merci. First question, Brett Forster, APTN News. Line open.
Hello, thanks for taking our questions today. My question is for Minister Miller, and it's about your rationale for the CHR judicial review, which you discussed at this last press conference, in which your opponents have criticized. If you concur with the tribunal's order and are going to implement it regardless, why do you need to judicially review it?
And thank you for the question, Brett. I won't mischaracterize your words, but the people that are advocates for children's organizations, whether it's people in the opposition, I don't consider to be my opponents. They're forceful advocates of a point of view, and we always invite them to the table to explain our rationale. I think that's important to note at the outset. This is a decision that was not taken lightly by any stretch of the imagination. Because we're talking about children, those that have been taken into care or have had the need for substantive equality that has not been afforded to them. What I want to make clear to anyone listening is that we are implementing the spirit of the order, but as we have said at the very beginning of this case, we do have some strong jurisdictional challenges to the authority of the court. It's something that we have been clear in our public messaging and clear in the articulation of our court cases. The Minister of Justice and I have taken an immense amount of time in reviewing pleadings and ensuring that we are moving forward in partnership along with and being guided by the litigation directives with respect to Indigenous peoples that we refer to all the time to ensure that we are only limiting our appeal to the essential of the argument and making sure that it is respectful towards our relationship of Indigenous peoples. Any child in a situation and in need of Jordan's Principle should contact Indigenous Services Canada. This is a process, and we are proud of the supports that we have extended to Indigenous communities, close to 800,000 over the last few years. But our challenge with respect to the authority of the Canadian Human Rights Tribunal and jurisdiction, particularly in areas and very, very sensitive areas of identity and belonging, without broad consultation, is one that we believe firmly is not within the purview of the court. And I can understand how hard that is to digest, and that is why we are attempting to articulate that in the most respectful way as part of our appeal, without at the same time, and I want to reiterate that, without at the same time prejudicing Indigenous children.
Do you have a follow-up, Brett?
Yes, thanks. The AFN frequently lobbies your government on behalf of hundreds of First Nations, and you often rely on them to provide that voice, and they support this ruling that expands eligibility criteria for Jordan's Principle. Why do you disagree with them on this matter?
I wouldn't characterize it as sharply as that, Brett. AFN has always said that it is not a rights holder. It has advocated very forcefully and very effectively on behalf of Indigenous peoples. I would invite you to ask them on the same question on those particular issues of identity and belonging, and not so much the ruling itself of the court. A ruling, again, that I will underscore that we will be applying in according and implementing Jordan's Principle.
Thank you. The next one is from Émilie Bergeron, Agence QMI. Ligne ouverte, à vous.
Oui, bonjour.
Good afternoon. Mr. Miller, in your statement, you extended your sympathies for the loved ones of Raphaël André. You said that it's a death that could have been avoided. How do you interpret and how do you react to the Legault government refusal to give an exemption, a curfew exemption for homeless people? Thank you, Émilie. What we know of this pandemic is that it has greatly affected our most vulnerable and our homeless population. I would have liked to have seen a bit more flexibility from the Premier of Quebec. I agree with what Mires Plante has said on the matter. Someone who is homeless is just like you or me. There's very little that separates us. Very little separates someone without a roof to someone like me who does have one. They have different experiences, but they're humans first and foremost, and they must be treated as such. If one is homeless, one wants to follow the rules, of course, but a rule that forces a curfew and forces someone to make the decision of seeking refuge in a chemical toilet goes to the heart of the debate, and we have to be a bit more humane, in my opinion. Homelessness did not start with COVID. COVID has exacerbated the precarious situation experienced by homeless people in certain shelters. There have been outbreaks, and I wonder if the federal government could have done more. We continue to offer financial resources to municipalities and provincial governments, and we will continue to do so. The federal government will always be present, offering as much as possible as a federal government. What I've learnt from all this is that it's not a question of financial resources as such, it's a question of logistics and coordination, and unfortunately there was a shortcoming that led to the tragic death of Raphael. I continue to think about the matter. Every level of government has failed in this case. We can do better, and that's what we've offered to the province and the city. A follow-up, Émilie? Yes. You said that every level of government has failed in this case. What part of the blame must the federal government shoulder when it comes to social housing, for example? Since the beginning of our term, be it for our work with the former Quebec Liberal government and the current Coalition Avenir Québec government, we've always worked with a bilateral housing strategy with them since the very beginning of the pandemic as well. We have offered financial amounts to fight against COVID-19. There were available places and shelters, but someone who is in a homeless situation makes a decision informed by their own situation. Sometimes there are psychological aspects that come into play. Sometimes there is an inability of finding a center of mitigation for them, risk mitigation. It would be too simplistic to blame one government, one level of government rather than another, because it's all an issue that we must all work on. When I entered politics as an MP for the centre of Montreal, I decided to be the voice of those who do not have a voice, and this includes those who are homeless. They need this voice, and it's a voice that I will continue to carry, be it in Montreal and with Indigenous peoples as well. There is this challenge as a minister. What I've tried to do since the very beginning is to make sure that we have the funds to accompany municipalities to help Indigenous homelessness, for example, and in particular, in this case, I continue to ask myself whether we could have done more. But as an MP, I must do more than thinking. I have to act as well, and that's what we are continuing to do with municipalities, with the province, with various networks. We continue to offer financial support, and any need will continue to be there for them.
Merci, opérateur.
Thank you. Merci. Next question, Dylan Robertson, Winnipeg Free Press. Line open.
Hi there. Happy New Year to you three. Thanks for doing the press conference today. I just wanted to get Minister Miller's impression of the three prairie provinces when it comes to the vaccine rollout. The Manitoba government has put First Nations in the driver's seat, even though it appears to be taking a bit of a delay in getting the vaccine out. We can't really say the same about the Métis here. And when it comes to Alberta and Saskatchewan, it seems like the First Nations are just fitting into the general care home protocol. Like, I'm not sure if there's a lot of collaboration happening there. So I just wanted to get your opinion on how these three are doing.
Well, I think, Dylan, you're speaking about three provinces that have some of the most active caseloads right now, so there is an urgency. As we work with the provinces to apply the NAICI guidelines, it's been clear from the get-go that there was a need to ensure that Indigenous communities were getting priority because of the vulnerabilities we're all aware of. That includes, I guess, what we call phase 1A of the vaccine rollout. And again, I need to caution that with the simple fact that everyone knows that we're working with very limited doses. So this is work that has been done at the trilateral tables that we have with Manitoba, Saskatchewan, or Alberta, in ensuring that we offer all the assets of the federal government to ensure that those doses are getting into the arms of those that are the most vulnerable. We saw at the very beginning of January, for example, the rollout of vaccines in Siksika and in their elders' home. So there has been some good uptake in Alberta. There's been some very good uptake in northern Manitoba, and in Saskatchewan as well. It is what we've seen with that cooperation with Indigenous communities is they are extremely well prepared for this. We're getting doses in there, and those doses are getting into arms. It's really admirable to see. It's surprising, I think, for many. If you look at any of the news stories about some of those doses getting in a disproportionately high amount, it is really an early success story. I think your concern, Dylan, is one that we all share with respect to the rollout of sort of the second wave of vaccines, when we're really talking about larger volumes and ensuring that, again, Indigenous communities get higher priority. I think you weren't part of the press conference last week, Dylan, but I touched on one element of that, which is you can't compare a long-term care facility in an Indigenous community with a long-term care facility outside an Indigenous community for two reasons. Often there aren't enough resources to have a long-term care facility, so often the elders that would be in a long-term care facility are actually living in congregate livings, and whether it's 5, 10, 15, 20 people, and so very vulnerable. That has to be acknowledged. We also have to acknowledge the fact that the vulnerability of Indigenous elders is that happens and occurs at a lower rate than it would with respect to non-Indigenous Canadians because of the lower outcomes of social determinants of health. These are all considerations that we're working with the province, and I would point you even to the protocol that Alberta has that has recognized that is a vulnerability that they're willing to address with respect to the lower age group. There is some nuance and subtlety that needs to be appreciated by health authorities, and it frankly is, even if that doesn't necessarily permeate at the political level. Another one of the good success stories, and it's a reflection of the vulnerability, is our efforts to get 75% of northern and remote communities vaccinated by the end of March, which will be north of, I believe, when you tally that all together, close to 100,000 individuals. I can get you those precise numbers, but this is something that we keep being focused on, and that doesn't happen without hard work at these trilateral tables, rather, among civil servants, most of them that hold health portfolios.
Do you have a follow-up, Dylan?
Yeah, thank you for the thorough answer there. And I wanted to talk about the military going back to Island Lake less than a month after they finished in Red Sucker Lake. They're now at Garden Hill. I'm wondering, does this tell us if they pulled out too soon, or that there isn't enough preventative support, or, is this just the reality of a highly transmittable virus?
Look, excellent question. I recently had a chance last week to speak with the chief of Red Sucker Lake, who is immensely pleased with the contribution that the military had made. It could be just the reality of the virus and the spread. One community that was hit earlier than the other and the protocols that we put in place as a team with DND to ensure that we're when we decide to put in the armed forces, which is not an easy decision to take, that is being done in a staged approach, principally to reduce the time in which we react to a request for assistance, but also ensuring that the right assets are in place. I mean, there's a very intricate analysis that we undertake at Indigenous Services Canada, along with the community, along with the Department of National Defence, to say to ourselves if, when, how, and in how much quantity the armed forces move in. And I wouldn't say no two communities are alike, and there's a process for engaging with them, getting a reconnaissance group in, whether it's a virtual reconnaissance or a direct reconnaissance, and then a ramp up to see exactly what assets need to be supported, whether it's more help with perimeter security, food security, whether it's help with key infrastructure assets, water operations. These are all considerations that the military has to assess really, really quickly to prevent a spread. And what we're trying to avoid is certainly situations that we saw in for example, Shamattawa, where overnight the cases sort of went from a couple dozen to about 200. And that's a process that we keep refining. And so I wouldn't compare two communities, but I wouldn't say it is necessarily surprising that they are closely situated.
Thank you. We'll now go to questions in the room. Nous allons maintenant passer aux questions dans la pièce. David?
Hi, everyone. David Thurton, CBC News. Thank you so much for answering our questions and for doing it in person. That's important, I feel. The first question I just want to ask you is about what's happening in the prairie provinces with active cases, total infections. It seems like the bulk of them, at least from the numbers we heard from you all last week, are concentrated there, the bulk proportion of cases. Can you tell us why is that happening? Is it more than just the housing situation, the other systemic inequalities that First Nations have borne in this country? What role is provincial restrictions playing in this? Minister, if you could provide a response, also Dr. Wong or anyone else would like to respond.
Yeah, we always want to get into a position where we can generalize trends so we can act quickly with further outbreaks. What we saw alarmingly when we saw the big jump from after the first wave was really northern Manitoba, and then with a quick spread into Saskatchewan and Alberta in a period of weeks. And I'll pass it over to Associate Deputy Minister after I answer this question, because I think this is stuff we assess and reassess in real time. What we've seen were issues in and around opening up of the economy. No doubt, I think it affected everyone. People let their guard down, for sure. It's human nature. It's very difficult to ask Indigenous communities to do something that we ourselves wouldn't do in non-Indigenous communities. Spread from big urban centers into more remote communities without the health. Congregate living, obviously people living in some examples in houses where there are 20 people, 15, 20 people. Funerals and weddings where emotions run high and people do let their guard down. All these protocols that are of human nature, and despite the fact that Indigenous communities have and continue to do really well, they have and continue to be facing odds that are 3 to 5 times greater than in a non-Indigenous communities. And you know, we look at the examples that exist to the south of us, and I would invite you to look at some of those statistics because they are scary. Those odds aren't different here. It's just Indigenous communities have been doing an excellent job in fighting those with the supports that they're working with. I don't know why it's 3 provinces in particular. There's a big bulk of Indigenous peoples, and there is vulnerability there. But I wouldn't want to try to tease out trends and conclusions in the middle of this wave. But I'd ask Dr. Gideon to complete that.
I think the minister answered it well. I would say that, you know, in Ontario and Quebec, where there has been some significant case numbers with respect to the general population, we have had lower active case numbers in the second wave than we have in the prairie provinces. So it is possible that where provincial public health measures limited access to public spaces, or at least had implemented some stringent public health measures in those public spaces. So examples would be, sport gatherings or, as the minister referred to, religious gatherings or, non-essential travel where that was permitted. Obviously may have exposed communities to greater risk. Restaurants, other type of leisurely spaces, if they had remained open at this point in time, it becomes very difficult for community members to limit the travel of their community members to those public spaces. We've seen that the highest funding request that we've received in terms of the Indigenous Community Support Fund needs-based envelope has been for perimeter security for communities to be able to try and control that to and from traffic into community. We have still close to 350 communities that have closed their borders to non-essential travel and are really maintaining their resolve in order to protect their community members. So those measures absolutely that communities are putting in place are critical, but they are facilitated by provincial measures that then apply to non-Indigenous communities as well.
So just let me follow up on that. I mean, you've said a lot there, but I just want you to tell me maybe just what responsibility do provincial restrictions play in keeping these cases as low as possible on First Nations? What do you want your message to be on that? Do they help? Would they make a difference? Would we see lower cases in the prairie provinces if maybe at a provincial level things looked a little different? Yeah.
What we've seen in this pandemic is there are a number of measures that contribute and prevent, correspondingly, prevent the spread of the virus, opening up of economies, health restrictions that need to be enforced and reinforced are the responsibility of the federal government and of the provincial governments. And so if you're trying to apply that to how that impacts Indigenous communities, the answer would be quite complex. If you look at the fiduciary duty of both crowns and rights of the government towards Indigenous peoples, they both exist. There is a primary responsibility that rests with the federal government, but no province is exempt from that. In fact, that duty does exist, and it's why they and that good faith a lot of the times has been quite positive in ensuring that we're all trying to speak with one voice to protect people. And so the more restrictive the measure, particularly when it's a measure that's been taken in consultation with Indigenous communities, is more effective. It's hard, as I mentioned in my earlier answer, to ask Indigenous communities to do something that you yourself wouldn't do. It's also important. There's been sort of a tendency to say, how come the federal government doesn't do X, Y, or Z and impose it? And it has proven to be our cooperation with Indigenous communities that has yielded the best results. So if you work in partnership with Indigenous communities and ensure that you have their voices heard, that's the best way of ensuring that everyone is safe at the end. It makes for much more complex work for people like Dr. Wong and Dr. Gideon, but it's actually more rewarding work because the results are there. I wouldn't ascribe one particular cause to why it's in the prairies, but certainly partnership with the provinces as a key health provider in the country is capital for us in ensuring that Indigenous communities stay safe.
Thank you. Next question.
Chris Reynolds, Canadian Press. We've heard a lot today about the efforts that have been made to prevent outbreaks in and respond to outbreaks in Indigenous communities, including remote and distant communities. I'm wondering, what have you done to try to ensure ready access to vaccination to Indigenous people who are living off-reserve, particularly in cities?
Yeah, I mean, look, it's an excellent question, and it has been a concern from the get-go, as you know, essentially the effective limitations of the federal government in being able to implement something on its own are on display, I guess, is the lack of a better expression when it comes to large urban centers where we see principally urban Indigenous communities. I wouldn't limit it to urban Indigenous communities and big urban centers. This is the case with respect to Métis populations. This was respect to the quote-unquote situation off reserve. This is the situation a little less so perhaps in the territories, but clearly the concern with serving those peoples who present the same vulnerabilities, the same challenges when it comes to hospitalizations, hospital and in ICU in particular. We have good data coming out of Manitoba that confirms what I have just said. This is a particularly acute issue and challenge when we're talking about the deployment of the vaccine. We need participation of the provinces to ensure that needles get into arms of people that are the most vulnerable. Foremost, what comes to mind is tracking and tracing of data to be able to answer your question in an articulate fashion, to give Canadians the satisfaction that those that are the most vulnerable have indeed been properly served by both the province and the feds. It is a testament to the effectiveness of the trilateral tables that we're working with the provinces to prioritize Indigenous groups, particularly urban Indigenous groups. And the role of the federal government, in my mind, is to offer our assets, offer our cooperation, our resources, our logistical capacities to ensure that should a need arise, for example, in Toronto that has started some vaccinations with Indigenous peoples, if the need arises in Montreal that I mentioned at the beginning, part of the homeless population served by that vaccination in Montreal will be Indigenous. I want to get a sense of what those numbers are. And so that is the partnership that we have with provinces to make sure all Indigenous peoples, whether they're quote unquote on or off reserve, which is a bit of a false dichotomy, are served because they do present the same level of vulnerabilities. It's the careful and frankly quiet work that we're doing with provinces at trilateral tables.
Can you give any other examples of how that prioritization is playing out in a practical way in a community like Toronto or Vancouver or anywhere else? In Manitoba, like you mentioned that there could be prioritization given to certain populations. Does that mean there'll be clinics set up with needles available for vaccination in certain areas of a city, or what's a practical example?
Yeah, and I don't know if Tom or Valerie, you want to add on to some of the specific examples that Chris is asking for, because you're asking a question that Dylan a bit alluded to, but a little more specifically. Certainly there's some clinics in Toronto that have opened up. The work in downtown Montreal that has just started. You're dealing with a phase of the rollout that hasn't quite come yet. Obviously, our concern with the downtown east side in Vancouver is top of mind. In Winnipeg, this is sort of the phase 1B or 2 of the rollout of the vaccine, when the numbers get larger and reflecting the need to distribute vaccines that are to those that are the most vulnerable, and in fact, in some cases, a vector of important spread because they themselves live in congregate living conditions. Right now, the focus has been on long-term care facilities, essential workers, but as we get into those phases, those are concerns that are top of mind, and in my case, top of mind as they regard Indigenous people. Val, you want to add, or Tom?
Yeah, at the same time, as we work with Indigenous partners and provinces and territories, to specifically prioritize elders as well as homes for the long-term care and elders lodges. We are working with partners, including urban partners, urban Indigenous partners, local health departments, provinces and territories, to really emphasize and advocate, for the inclusion in the rollout early on vaccines for underserved First Nation, Métis, and Inuit people. Whether it's in Ontario, whether it's in Manitoba, whether it's in Quebec and BC, all of those discussions are actively taking place, and we are very glad that in some of jurisdictions they are already making plans in the coming days and weeks to actually specifically support First Nation, Métis, and Inuit in those downtown inner city hard to reach areas to actually offer the vaccination. So
Thank you. Next question.
Hi, Rachel Haynes here from CTV National News. I just wanted to go back to, Minister, what you were saying about reaching 75% of northern and remote communities by the end of March. And I'd like to know how the territories fit into that strategy, because right now the Northwest Territories have only used up about 26% of the vaccines that they've received so far, and Yukon has only used up about 18% of the vaccines that they've received so far. And we know that there are not any supply or delays in the supply of Moderna vaccines. So can you tell me a little bit about why there is a little bit of a slower rollout we're seeing there?
I don't know if Valerie, you want to add on, but I wouldn't say it's slow. There's an immense amount of logistics in deploying those vaccines into communities, and I would say they would differ. They would differ obviously in Nunavut as opposed to the Northwest Territories. We're talking about vast expanses. I think they are in a great position to be able to roll out their vaccine. They have targeted community rollouts, but they also have larger clinics. In the case of my colleague Mike McLeod, who got vaccinated yesterday, are now available to pretty much to anyone. I think, I'm cautiously optimistic, but they're well on track to meeting that goal. They've done an exceptional job given the huge logistical challenges of getting that vaccine out. I haven't seen your numbers. I'd have to look at them and scrub them myself to be able to comment on them intelligently. But I have the utmost confidence in the territories because they've frankly so far done an excellent job, and the numbers I see are actually quite positive.
Unless Tom has more to add, I would just say that they have a significant number of clinics that are planned. They have a schedule that they've outlined. We will continue to offer any assistance that they may require, but at this point, it does absolutely seem to be a quite well-organized effort. Tom, anything further that you'd like to share?
All three territories, have a lot of geographic distances to cover, and many are so isolated. It's a flying community, for example, and they're mobilizing everything with the support, from us in order to reach those very far away, remote and isolated communities. I have no concern. About the excellent work that the territories, have been working together with the Indigenous partners in order to actually roll out and extend, the vaccine clinics to the far, far north. It does, take a few days, in order to get, things done. It's a lot harder than, organizing a clinic, say, in downtown Ottawa.
So would you say then you're on track to meet that goal of 75% of northern and remote communities? Have you received any requests for more federal assistance in order to meet that goal?
I'd say, and I passed it off to my officials to see if they've heard any additional requests. We'll assess ongoing requests and be there to help them every step of the way, but I have heard no indication that we are not on track, and every indication to me is that we are well on track, and that is positive.
The only thing I'd say is the Public Health Agency of Canada is working closely with them as well, and mobilizing any requests for any portable freezers or any type of supply and equipment that may be required, as well as anything required through the National Emergency Stockpile System that is managed by the Public Health Agency of Canada.
Merci. Nous allons maintenant retourner au téléphone pour deux dernières questions. We'll now go back to the phone for two last questions. Operator.
Thank you. Merci. Prochaine question, Marie-Laure Josselin, Radio-Canada. À vous.
Oui, bonjour.
Good afternoon. My question has to do with homelessness and what happened in Montreal with Raphaël André. Are you discussing with Quebec City? And what do you have to say to associations that are asking for the army to step in and help them? Yes. Answer, yes, indeed. We've received a request from an association that represents Indigenous women, and in that respect, I would like to note that we have offered them funding about $1 million to help their exceptional work for Indigenous women and for general resilience. We've also offered financial support to other Montreal City Centre associations and organizations. As they know, we can offer assets, we can offer funding or other assets like the Canadian Army. But this requires the approval from the provincial government. What I understand through our discussions is that it's not a question of having just tents. The Army would perhaps not be the most appropriate organization to deal with people who are in a situation where they need, for example, a harm reduction center. It's a question of logistics and of staffing rather than assets through tents or other similar assets. That being said, someone who has the authority must be listened to. And what I've heard is that these associations need more help. And through our dialogue with organizations or the City of Montreal or the CUSS, for them the issue isn't an issue of financing but of coordination and logistics. A follow-up? Before my follow-up, have you talked about the province, about this with the province, because the Army has doctors and nurses? What I can say is that we have offered all federal assets that are available.
Thank you. Merci. Next question, Christy Kirkup, The Globe and Mail. Line.
Hi, good afternoon. My question is for Dr. Wong. During your opening statement, you talked about the alarming number of cases, and just looking at the epidemiological breakdown on the ISC website, you can see the curve going right up. You can see it swinging upwards. And I know you indicated the department is aware of more than 5,571 active cases for First Nations reserves. Can you, again, you used the word alarming. Why is this alarming, and how can the curve be brought down?
Yeah, this is alarming because when you actually look at the first wave in Canada, we're looking at the number of active cases that's at this moment much higher, than that of the peak of the first wave. So for comparison, at the peak time during the wave one, we had in Canada for First Nations communities a total of active cases that's at 99, so just under 100 cases. So now we're looking at over 5,500 active cases. And when you look at the trend over the past couple of weeks, the increasing trend continues. There are a number of reasons, including the impact from outside of First Nations communities, meaning in the provinces, where there's a lot of cases. But also, we have to actually take into account about the holidays during the Christmas New Year period, where there's gatherings, where there's travel. And with that, it's not just affecting First Nations on reserve, it's affecting the entire province, and it involves many different provinces, as well. As a result of that, if the rate doesn't come down with the public health measures, we would be in a situation, where Canada, the health system, the entire health system, will be overwhelmed. And you have heard, about different provinces talking about their hospital capacity as well as their ICU capacity. We don't want that to happen. I think that when you look at what's successful in the first wave, all of the public health measures, in addition to that, we now have limited supply of the 2 vaccines, and hopefully we will have more vaccines in the near future beyond these 2 after very careful and rigorous regulatory reviews and approval process. Thank you.
Can I just add, Kirsty, I think, as Tom said, at the peak of the first wave, the total number of Indigenous people on reserve that had COVID was about 400, and now that total is up to, it's closing in on 14,000. And we said at the very beginning that we were exceedingly worried that this would impact, the second wave would hit Indigenous communities much harder, and we have seen that to be the case. I mean, Manitoba is one of the examples that had, I think, 0 cases on reserve, and it's skyrocketed ever since. The reasons for that are multiple, and I would say that, you know, when you get a case in a community, it can become a tinderbox because of housing conditions in some cases, difficult to generalize, but we're talking about generalities. But it can spread very, very quickly. Over the Christmas holidays, we saw a really rapid rate of active cases, which, generally speaking, is a trend, roughly a trending 14-day average. So when you see that going up, you know that there's rapid increase in the community. There's roughly a plateau of about 4,000 in and around Christmas, and then now it's jumped up as a result of the cases from that period to about 5,500. What we don't want to see is that trend continue, because that active cases represents a condensed amount of cases over a 14-day period that keeps spiking, and those curves are accurate. So what we're saying to Canadians, to Indigenous peoples, is now is not the time to let down your guard. This is not the time to ease public health restrictions. What worked during the first wave will work during the second wave, but when it sets in a community, we have to act quickly to prevent cases going from 510 to 200, as we have seen in a number of communities. That can happen something like overnight.
Do you have a follow-up, Christine?
Dr. Wong, you mentioned the limited supply of vaccines. Of course, it was just announced that there will be 0 doses of Pfizer vaccines arriving next week. Given this, alarming spread in Indigenous communities and elsewhere, is this a race against time? What is the situation that is before us right now?
Thank you, for the follow-up question. The fact that, right now, for northern remote Indigenous community, the use of Moderna vaccine is critically important, and it's always been planned, to offer Moderna vaccine because of, its ease of transportation. It just needs a -20 degrees Celsius instead of -80, and it can be stored in the refrigerator for a month versus only be able to store in the refrigerator of a Pfizer vaccine for 5 days. Because of all of those reasons, and because of the fact that Moderna vaccine is not impacted, by this temporary situation with Pfizer. Therefore, all of the Indigenous communities, are going forward, with vaccination clinics using the Moderna vaccine, including in the territories in Inuit and Ngada, in First Nations and Métis community. We are very confident that with the Moderna vaccine, and that there's no shortage of Moderna vaccine at the moment, that it will reach more and more communities and more people in the coming days. Thank you.
Thank you. Merci. Ceci met fin à la conférence de presse. This ends the press conference for today.